Hi everyone, it's Lisa Moeller with MedMark Media, and welcome to another edition of Doc Talk Dental. We are very excited today to be chatting with Dr. Michael Kelly. He resides here in our own backyard of Scottsdale, Arizona since 2010 and originally hails from Florida. Dr. Kelly attended Stetson University in Florida for his undergraduate training in chemistry and then graduated from Medical College of Georgia School of Dentistry in 1993. His commitment to dental excellence is shown by his attainment of mastership in the International College of Oral Implantologists, over 2,200 hours of advanced study, his mastership in the Academy of General Dentistry, and his work towards accreditation in the American Academy of Cosmetic Dentistry. Welcome, Dr. Kelly.
Thank you.
So nice to have you with us
I'm
today.
really excited to be here and get to share some fun technology that just makes our clinical practice that much easier and better for us and better for patients.
Absolutely. So tell us how you got into dentistry, or why you got into dentistry in the first place. I always like to start with that.
I was one of those rare kids back in middle school that actually had to do a science fair project, and I did a science fair project with my sister's orthodontist, and was exposed to dentistry really for the first time like that. And I always knew that I love science, but I love working with my hands. And I think most of all, I really wanted a career that gave me an ability to develop relationships with patients. Whereas medicine, you pretty much see people when they're sick. Whereas dentistry, we're seeing them over a lifetime. And I think one of the most rewarding parts of my practice was starting to get to take care of like children of the children that I first took care of, and those long-term relationships. No, I'm a little older than what I look. So, but it's a lot. That's a lot of fun, and just being able to develop relationships and care for people, and still provide a good family life for us, so that I'm not on call all the time and not in the emergency room or hospitals all the time.
Right, absolutely. So you're a general dentist, but you also do quite a few implants.
Correct.
Tell us how you arrived at wanting to place implants and how that all took place.
I think, like most general dentists, when we, at the time I went through dental school, implants were a very minor part of our training. They were really in early stages. They were only for patients that had a lot of means or for special cases. And over the years, as they got more popular, I think a lot of general dentists kind of look at that, because by the time you diagnose it, you refer the patient out to a specialist. They go through all the planning process. It becomes so complex that a lot of general dentists almost look for excuses like, well, I can just do a bridge in this case, or I can do, and then you get to a point at some point in your career where you start thinking, well, what would I do? If that were me in the chair, what would I want? Or if that's my wife in the chair, what am I going to recommend for them?
Right.
And when you can no longer answer that the compromised care is what you would want, we offer the patient what's best. So at first I started with implants, basically just doing restoration, just restoring what the surgeons were placing. And then as I started to be less and less happy with what I was seeing come back, I decided to take more of that into my control, but needed to add the technologies that allow me to do that and do that predictably into a general practice.
Right. So tell us about your training programs currently that you're doing for doctors.
So we love to focus on helping doctors add technologies to their practice, and technologies that make dentistry more fun, more predictable, better for patients, and better for the dentist.
Right.
So I do a lot of training with Carestream Dental. So they have an amazing digital scanner that is plug and play and easily moves from operatories. We show doctors how to integrate that technology with their cone beam X-ray machine. In our practice, we have the Carestream CS 9300, which is a full field cone beam machine.
And you
Very
use
low
the
radiation.
CS3600 scanner.
We use a CS3600
Okay, so
scanner.
in combination.
In combination. So I use that individually for all my restorative patients, but then I also use it in combination for implant planning.
Right.
But we teach how to use those together. We also work heavily with a laser called the Soleil laser, and we use all those technologies in combination with one another to achieve just great results and comfort for the patients. And so a lot of the courses that we do revolve around how to use those technologies and how to incorporate them and then use them together for the best results.
Right. And isn't that what it's all about today, is taking care of the patients in the most effective, efficient manner. And the technology such as what Carestream Dental puts out is absolutely amazing.
It is. And
I honestly wouldn't go get treated for any dental work if my doctor didn't have this type of equipment.
I would not either, and I wouldn't let a family member have work done without using the equipment that we have for safety reasons, for predictability reasons. It's just so much better for our patients. And
Right.
It's better for us as dentists too.
Absolutely. So tell us about some of your more complex, couple of your more complex cases that you've had and the Carestream Dental equipment that has helped you along the way with those.
Sure. We've have been working on a case recently. About a 50-year-old lady came in. She's had extensive dental work for her life. She actually invested probably 10 to 15 years ago in some beautiful veneers. Her smile is gorgeous, but unfortunately the substructure that's underneath that beautiful smile is failing and crumbling.
Uh-oh.
And she noticed that one of her front teeth was starting to get a little loose. Went to a specialist, had it looked at, and they kind of patched things together for a little bit and said, you're going to need implants. Well, she went on a series of consultations looking at doctors to treat her, and one of her criteria is she wanted to go someplace that would make her treatment as simple and predictable as possible. So because I do a lot of high-end cosmetics as well, she felt very comfortable in my hands because I could do the implant work
Right.
and do the cosmetic work afterwards. And I was looking at both of those together of how are we going to plan this case to make your life easy. So she has very limited bone in areas that we needed implants. She's got failing root canals. She was going to need surgery, but then at the end of the day, she wants to end up with teeth that are as pretty as what she already had.
Right, right.
So it's really nice to go into that case knowing exactly what I'm going to need to do, what materials I need to order, what complications we're going to face before I ever touch her.
Absolutely. Well, I think a lot of patients don't realize that, veneers don't last forever. Right. And, you're going to, at some point, you're going to have to, there's going to be something that's going on with them that's going to need to be fixed or adjusted.
Sure.
And this equipment just makes that so much easier for your diagnosis.
Knowing
correct?
what's underneath is essential.
Right, right. So how are patients reacting to this technology?
I think the biggest thing is they love the predictability of it. Whenever you're having major dental work like that, it's normal to be apprehensive, to be nervous, to be scared.
Yeah.
But if you think of any surgery you want to have done, if your surgeon can anticipate what things are going to look like at the end of surgery and can visualize the final result before they even start the case, it gives you a lot more confidence. So what I see is greater case acceptance. I see calmer patients going in. I'm also able to give them a better estimate of their care because I know what I'm going to get into before I even start treating them. So I know whether they're going to need a graft. I know whether they're going to need a specialized abutment. So
Right.
I can plan better and plan my fee structure better for that patient. And I never like surprising people at the end of treatment going, oh, yeah, I know I told you this, but it's going to be more difficult.
No, that's never fun to get surprises like that.
No.
I'm sure that seeing the case before you actually begin, that just puts the patient completely more at ease with what's going to be happening, because these are big, procedures. They're not just, you're not just filling a cavity.
Well, they say, that picture's worth 1,000 words. Well, when you can see your jaw up there or your skull with a simulated implant in place with an overlay of what your teeth actually look like now and see where those are going to come through, if that patient needs a graft, it's very clear to understand, okay, well, the implant is really close or it's sticking out of the bone. Oh, wow, yeah, I'm going to need a graft there. Or they understand that, and they can, this treatment is very complex.
Yeah.
And it's really hard for patients to understand some of that. So the better visual capability we have of showing them, hey, this is what we're going to do, this is why we're going to do it, and this is what it looks like, I think the better they can comprehend their treatment, the better they can accept and feel comfortable moving forward with that.
Right, right. Can you describe any other challenging cases that were made easier because of Carestream Dental equipment that you used?
You know, my day-to-day use of the CS3600, so their digital scanner, being able to take what used to take me 4 to 5 weeks to have a final restoration made on an implant. So I can now use my laser to uncover the implant, to put a scan body on that implant, which is a little plastic marker that allows us to record where the implant is in space in that three-dimensional impression, scan that, send it back into the back of our office into our lab environment, bring the patient back the next day and give them their final restoration.
Wow.
And that used to be a 4 to 5 week process,
Right.
multiple impressions. To do that in many times with either topical anesthetic or no anesthetic at all, no bleeding, no stitches, it just makes for a much happier patient. And it streamlines my process, so my costs go down as well. The better planning I do, the better I utilize this technology, the better it is for the patient and for us.
Yeah, that's huge. That's really huge. So it's obvious what keeps you passionate about dentistry, because really you're here to help your patients. I mean, that's obvious in our chat so far. But what would you say other than patient care and keeps you passionate about what you do every day?
I love learning, and I love using technology to make dentistry more fun and more predictable. You know, this career is not real easy on our bodies either.
No,
There's a
I can
reason why all the,
imagine.
like most of the 70-year-old dentists are hunchback and deaf in their left ear, is because they spend their lives kind of hunched over patients.
Yeah.
So when we can use technologies that help our ergonomics, help us plan, help make cases where we're spending less time in the chair more predictable, it's better for us.
Right. So Dr. Kelly, you mentioned the scanner, but what are some of the other applications that you use the Carestream Dental imaging equipment for in your practice?
Sure. You know, it becomes, because it's a very versatile machine, that machine is also my Panorex, so I'm using it for screening applications and things like that, just for routine dentistry. But then on those patients that are going to need anything, so they have a tooth that's not erupting properly, I can see exactly where that tooth is and why it might be held up for orthodontic purposes, things like that. So I know exactly where that is if we have to uncover it.
Right.
My sleep practice, so we get a lot involved in airway management and sleep evaluation, and being able to have a three-dimensional look at what that patient's airway looks like allows me to better diagnose and better help get that patient the treatment that they need into the hands of the right professional to take care of that.
That's so important these days.
Oh my gosh.
With sleep apnea being an epidemic, I have a publication on it, Dental Sleep Practice, just dedicated to sleep apnea.
I love that publication, and it just gives so many treatment alternatives and great articles on that. So thank you for that, and it's a valuable part of my practice.
Right.
But yeah, you're right. I mean, it is truly an epidemic, and I'm staggered when you look at the statistics of how many people are affected by that.
I know, me too.
And then the routine part of dentistry that we do. So we're talking about really big implant cases and very, very complex implant cases. But even the single unit posterior case, how valuable is it for me to know within 1/10 of a millimeter where that patient's structures are that are dangerous to get near?
Super valuable.
I would want that used on me.
Absolutely.
So to know that and know what size of implant am I going to need, it helps me streamline my inventory. I can pre-order rather than having to have 100 different implants in my practice, I can keep an inventory of 10, and if I need to swap that out or whatever, I know what I'm going to be using before I even use it.
Yeah, that's a good point.
So
It's more economical for you in the long run. Yeah.
What I love about the scanner is it's amazingly accurate when I need it for that, but it's a very versatile piece of equipment that really is used all throughout my general practice in dentistry.
Right. That I really don't think any specialist should be without this type of equipment, whether it be Carestream Dental or another CBCT. But they are by far the best out there. What they do.
The 3600, the digital impression scanner, it avoids the gagging, so it's got a great patient feedback. But for us as a dentist, it's more accurate, it's faster. It's more portable, so I don't have to put an impression in a box and mail it across the country. It's there through my email it to them through a secure portal, and it's there like that. And if that technician needs to look at it, the technician can pull it up. I can be looking at the other end, and we're talking about the case within 2 minutes.
Wow!
Rather than, hey, let me mail you this, and it's there, and we're paying for FedEx and losing the case, or then having to pull it up, and it's so much easier.
So high tech.
And the cone beam machine, that just having that and being able to look with a patient, but then also me being able to use that and use those technologies in conjunction, I would not have an implant placed on me without someone having that information.
No way.
And I can't imagine having my patients do that.
No, absolutely not. And what did, we were talking earlier, but what did doctors do 30 years ago that did not have this technology? I can't even imagine.
They were, I guess I could only say that they were incredibly courageous, or brave, or just very cavalier about what they were doing, because obviously they had to pioneer this, but we didn't have the technology where they could really see, and it was a guessing game. And it was somebody that had the courage to kind of adapt on the fly, which sometimes we still have to do, but let's avoid that as much as possible. Let's know what we're getting into before we start.
Right, right. So, Dr. Kelly, share with our audience some of your best practices that you've used in your practice that could help them.
As a practitioner, we're always concerned about, we want to take great care of our patients, but we all are also running businesses. And I think, there's nothing wrong with that. We just want to put the patients first.
Right.
But when we run a business, a lot of us are afraid to invest in technology because we look at the price tag and we're like, oh my gosh, that piece of equipment's $100,000, and that's a lot of money. But don't be afraid to leverage technology. To leverage technologies that allow you to do more procedures, that allow you to do them more predictably, more comfortably. Patients expect and want that type of treatment nowadays, and quite honestly, they deserve that kind of treatment nowadays.
Right.
So by leveraging those technologies, getting rid of the impression material, we've been using some things in dentistry for 50, 60, 80 years and doing it the same way. And yet these technologies have been available, and people just aren't incorporating because they look at the price tag and they're like, oh, I don't know. But honestly, when you really look at the end result, the economics are better for the dentist too.
Absolutely. I mean, it's the old adage, it takes money to make money. Absolutely. I mean, you have to always invest in your business, and you're doing this not only for yourself, but for the patients.
Absolutely.
So that's huge.
I think another one is to don't ever forget that even though you're a dentist and you're working on your business growth, to never forget your personal growth as well. I see a lot of people, and they spend their entire lives building their practice or building a bigger and better machine, and they get all done, and they've gone through 2 or 3 wives in the process, and they've gone through, their friendships, and they basically are building their practice at the expense of their personal and family lives. And life is a lot more than just dentistry. So lastly, I think that my best practice is to make sure that you invest time in a plan before you start working. And this goes throughout life, just almost everything that we do. the better you plan something, the more efficient and the better it's going to turn out. So when we invest that time on the front end in planning and knowing what we're going to be doing, then we're able to just streamline what's happened. It's more predictable. It's easier. You know, we talked about those doctors that were doing implant dentistry with just two-dimensional technology, and how stressful. I know personally that kind of stress level going into that would have been really hard on me. So going into cases that are I know what I'm going to experience, I know what it's going to be like, it makes me a lot more confident personally, and knowing that I'm going to take better care of that patient.
Right.
So
you're probably a planner in your real life, right? In your
very much so,
in your personal
yes.
life as well as your work
Very
life.
much
I can
so.
tell. Well, that's why you're successful.
So
Absolutely. Well, thank you so much for joining us today. It's been a pleasure to sit down and talk with
Thank you, Lisa.
Since you're in Scottsdale, will you come back and visit us again?
I'd love to.
Okay.
So thank you very much for.
Thank you so much. We'll see you soon.
Absolutely.
Take care. So that's going to do it for another edition of Doc Talk Dental. A special thank you to Dr. Michael Kelly for sharing his time and knowledge with us. And for more information on Dr. Kelly's practice, please go to aestheticdentistryofscottsdale.com. We'd also like to thank Carestream Dental for sponsoring this important episode. For more information on Carestream Dental products, please go to carestreamdental.com. As always, for more info on everything implant related, check out our publication Implant Practice at implantpracticeus.com. We hope you've enjoyed your time with us today and look forward to seeing you again very soon. Take care, everyone.